There is a growing number of patients who are suffering the pain and problems associated with the joint in the body, like rheumatoid arthritis, juvenile idiopathic arthritis, osteoarthritis, degenerative arthritis, etc. Very powerful medications that block immune activity fail to give relief to many patients of autoimmune disorders like rheumatism and psoriatic arthritis. In parallel, there is a growing number who suffer from joint wear and tear and undergo replacement of the knee, hip, vertebral disc, etc. Uric acid associated arthritis is also associated with the chronic medication. Unfortunately, medications and surgeries do not cure the disease. Why is it so? The reason is that these diseases are of lifestyle origin, which means that the problems associated with the lifestyle are causing the disease. It is not possible to cure these lifestyle diseases without correcting the problem in the lifestyle of the patient. How is it possible to get freedom from such diseases with the lifestyle modulation? What should arthritis patient take special note of? Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind the health condition, measures for early detection, tests to assess the current status of the disease condition, present treatment options in modern medicine with the benefits and limitations. Also, I will try to convey the fundamental relationship of this health condition with the lifestyle and impact of correction of lifestyle has on reversing and preventing recurrence of this health condition. This is why the video may appear long. To help you save time, we have time-stamped the topics in the description below for those who prefer it. Here the focus is on those who would like to make more informed decisions on matters concerning their health. This is important, especially when they would like to avoid surgery and chronic medication with the added effort from their part. It should be remembered that those who are on medication should reduce or stop medicine only under medical supervision. If someone wants to overcome the problem of arthritis, first we should know what is arthritis. Basically, arthritis is the disease of the joints. What is a joint actually? In our body, there are almost 230 bones and 350 joints. These joints are the connecting. This joint is connecting two bones or two or three or more bones together actually. So there are almost 350 joints in our body, and there is these joints are again hold it in position and activated, and our movements are possible with the muscles. So when the movement, the purpose of the joint is to make us body to move and make us flexible, and that is possible. Movement is possible with the coordinated action of the brain, nerves, muscles, and joint. The joint is made of this joint. There is a joint capsule is there, ligaments are there, and inside there is a covering. Most of the joints there will be a synovial membrane is there. So that is producing a lubricant. Actually, for all the engines we put some lubricants like engine oil is there. So just like any moving parts, there is a lubrication is needed, and that is provided by the synovial fluid, and for that there is a membrane inside, synovial membrane is inside. And joints like knee joints and the shoulder joints or the elbow joints, which needs more motion, more movement, or more flexible, are of the type of synovial joints. So there is more fluid and these lubricants are there. And another type of more joints with less movements, that is cartilaginous joint. The cartilage is the main part, or joint mainly, that is the intervertebral. The vertebra is flexible, but the limited movement only, not like a hand or the knee. There is not much movement is needed. That is made of, they are called cartilaginous joints. Next, another type of joint is fibrous joints. That is actually the skull. Our brain is protected inside the skull cavity, no? So the skull is not a it is not a single bone. There are many bones formed together to form the skull bone, and there is movement is needed, especially during the birth of the baby. That the child, this movement, the skull is very flexible. That movement is more there, but in an adult there is not much movement. That is called the fibrous joints actually. Then next we need to come to the symptoms of a joint problem, that is arthritis. What is the symptoms? The most noticeable symptom is the joint pain. The affected joint will be having pain, and also it can be swollen, swelling or edema can be there, and also there can be redness, and the joint becomes, when the swelling, pain and this redness and inflammation, there are the signs of inflammation, and finally it becomes stiff or the mobility is restricted. That is the cardinal signs of inflammation. That are the symptoms. The symptoms are the signs of inflammation. Actually, it is a protective for us to, the body is saying there is a problem, you deal with it, I am suffering. And the pain says that you are suffering, and there can be fever also, the joint is become hot also. That are the signs of inflammation, or the body is in a defense mode. There is a problem. That is what we should understand. Then to diagnose what is the problem. Is there a fracture, or is there an infection, or what is happening inside the joint? That we can check it with an X-ray, and then your modalities like a CT scan, MRI, those scans are there. If you are suspecting a cancer, we can think of a PET scan, and there are bone scans also. But for the joint, we usually check with the X-ray, CT and MRI will be sufficient. Next is the changes will be there in the blood also. The blood is traveling all the parts in the through the joint, through the bone, everywhere the blood is flowing. No? So the blood, we can give a lot of information on also. And in the blood, we check for the inflammatory markers first, because the pain and swelling and redness and fever and all is of the symptoms of inflammation. So we can see what are the inflammatory markers which is showing up. That is ESR, blood count, what is the number of WBCs, and what is the CRP, this C-reactive protein, high sensitivity C-reactive protein. It all gives an indication of whether it is only the joint is affected or the blood vessels. Usually this sort of autoimmune diseases, that is actually rheumatism and all, it is a collagen vascular disease. Actually collagen is a protein, and which is the bone and joints are formed, because especially the joint capsule, the ligaments and all, the collagen protein is very important. And also the blood vessels and heart also is made of, by the part of the heart, especially the valves, blood vessels, all needs collagen. If the joint is affected, there is very high likely chance of the other collagen using for the as a bodybuilder, the collagen is used, that part also can be affected. Next blood test we should check is to other organs is involved, whether the other organs like heart or kidney. Usually these autoimmune diseases like SLE, the joint manifestation will be there, and also kidney can be affected, especially GFR. That the earliest sign usually shows the kidney disease is GFR, and also protein or albumin loss in the urine, and also RBCs, that is the smallest cell, that can be that also appear in the urine if the kidney is damaged. So, and the autoimmune disease, if it is an autoimmune rheumatism, the liver can be affected, NASH or the non-alcoholic hepatitis can occur, and even the eyes can, if the eye pain or vision problems, the eyes to be tested. So if the joint is affected, especially with an autoimmune disease, any other organ in the body can also be affected. So the differential diagnosis of osteoarthritis, rheumatoid arthritis, seropositive arthritis, seronegative arthritis, all of usually of some significance is there. If it is no other part is affected, it can be mainly of a degenerative or osteoarthritis type. So we don't have to worry about other organs. But if the autoimmune positive or HLA positive, that also is important. If it is a genetic HLA positive and all, then we should always look for other organ damages also, other than the joints too. Next, when we come to the different types of joint problems, one is degenerative diseases, other is autoimmune disease. Next is gout, that is a metabolic disorder actually, gout. And it can be of infection also, infective arthritis can be. That are the major four groups actually. In degenerative type, that is osteoarthritis actually, the most common. Osteoarthritis of the knee, hip, or the vertebral disc, that is the most common degenerative type of disease. In this osteoarthritis, what is happening is the cartilage is getting damaged. Especially for the synovial joint and fibrocartilaginous joint, the cartilage part is getting damaged and it is getting inflamed, and that is the reason for this osteoarthritis sort of thing. And the bone is get exposed, and when the bone is get exposed and it start rubbing each other, the pain occurs, and the joint become stiffness comes, and there can be adhesion and fibrosis. At the end stage, this joint itself will be fusing, but both the bones are getting fused actually. That is the end stage. By the time there will not be any flexibility or movement is there. What is the reason for such degenerative disease actually? The reason is mainly, it can be started with an injury. If you have a fall and you have injury to the knee, it can happen, or some fracture or something happen to that part, and then gradual slow onset of the inflammatory process starts, and it is grown out of control and start destroying the cartilage inside at the tip of the bones of the cartilage, and the joint cartilage is getting damaged. And next is obesity, especially for the knee arthritis and the degenerative spinal problem, vertebral problems. The major problem is obesity. So when the obesity is there, that you have to apply more, the workload on the joint is high, especially in the lower limb, the hip and the knee. The workload, that it has to hold so much of weight. The body may be bent to hold the weight of 60 kg, but the patient weight can be 80, 90, 100 or above 100. So the joint is not able to hold that much weight, and the joint started degenerating. Most of these obese patients, if it is they are not working, the muscles also get weak. This osteoporosis also can happen. Then this muscles also get, this sarcopenia can come. So when this old age and comes to this muscle and joint loss also, the muscle has an important role in separating and keeping the bones flexible and the cavity normal. When the muscle is getting weak, it again increases the pressure on the bone, each of the bones, because muscle also, the tautness of the muscle is very important in keeping the bone active and the joint in its original posture, and the integrity is maintained because of the muscles also. Next, when we come to autoimmune disease, autoimmune arthropathy, it's a long list of diseases are there actually. It is rheumatism, rheumatoid arthritis we know, and rheumatic fever that we know, that is actually a reaction to bacterial infection called a streptococcal infection, and it can come on the tonsillitis or as a dental infection, and our body is making an antibody, and it is having a structural similarity to our bone and joint protein, and they go and attack that part. Actually, this in rheumatic fever, it is not generally called, rheumatic fever lick the joints and bite the heart. That is the usual term in the medical terminology, the medical professors and use. So it will give some pain and all, and some stiffness and all, but it will go off. But if it is recurring rheumatic fever with the streptococcal infection, the heart is getting damaged. Then many people with this mitral valve, that is very common in Kerala, in my part of the country. those patients who is requiring mitral valve replacement is so high. It is because of this rheumatic fever, that is the reactive arthritis, actually, sort of reactive arthritis. There are other inflammatory arthritis also of reactive nature. Actually it starts after, just like rheumatic fever, it starts after the streptococcal infection. So other urinary infection or intestinal infection, and even the latest study shows that this ankylosing spondylitis, that is also another autoimmune disease that is affecting the intervertebral joints, actually. That is also very common. The latest study shows that there is some sort of Klebsiella pneumonia infection, that is overgrowth of the Klebsiella in our intestinal. This thing is one of the reasons for this ankylosing spondylitis. And there is a genetic connection also. That is, HLA-B27 positive patients are more prone for this sort of rheumatoid arthritis, and also for the ankylosing spondylitis, and this reactive arthritis, like even the juvenile idiopathic arthritis. That is also, the latest information is that also is of reactive nature. The only thing, in different diseases in different parts of the joint also, joint is affected. In reactive arthritis, actually the enthesitis, it is called enthesitis. That is actually the tendons joining, attaching to the bone, that part is actually inflamed. Tendon or the joint capsule or the ligaments attachment is getting affected. In rheumatoid arthritis, the whole joint capsule and also the ligaments and other things get affected. In rheumatoid arthritis, it is the cartilage it is getting affected, because everything, it is basically the immune system is at fault. The immune system is reacting against our own body. That is the fundamental thing in all these arthritis. Only thing, according to the age, if it is occurring in a child, we call it as juvenile idiopathic arthritis. And it can affect the other systems also. Even ankylosing spondylitis can other systems of the body. It's all any body part which has a collagen part is there, it can get affected. And even the sclera, the eye has this collagen, the sclera can be affected. The uveitis can come. Even the kidney can be damaged. Liver can be damaged. Lung disease, interstitial fibrosis can occur. So even the SLE, that is another type of autoimmune disease. And this also, the major manifestation can be joint pain and myalgia. And even one Lyme disease, not common in our country, but in Western countries like America and all, the Lyme disease, that is a tick bite, and actually the tick is not creating problem. Tick bite induces an Borrelia bacteria into our system, and our system start making antibodies against this Borrelia, and that is having some similarity with our collagen. And even it can manifest initially as a skin disease, and then the joint and multiple organs can be affected. That is even in Kerala, we have seen a report of first time, it's a Lyme disease is reported, because we are all traveling, even the tick can come over here also. So especially the Malayalis are traveling a lot, or other countries like US and other continents, so many Malayalis, and they are coming here and bringing, even the ticks can be brought here. And there is a possibility, because of globalization, there is a possibility of getting the confined to one area can be coming to other area. Only whether the tick will be able to survive here, that is and the bacteria can survive here. That is the question. That is the only thing which matters when with the globalization of all our things, that globalization of diseases also will come. When we come to the predisposing factors, or what type of a person can get such a disease. See, when it is a degenerative disease, definitely obesity has an important role, because it will strain the vertebral column and your appendicular system, that is the leg and ankle and all, the alignment and all. The body has to take the excess weight, especially if you are obesity with abdominal obesity, the vertebral column, that alignment can be changed. So it will create a degenerative change in the disc. So one of the major reasons for this spinal problems, especially disc degeneration and all, this obesity is a major problem. And when an obesity is there, there is a problem with the most of them are diabetic also. When the diabetes, even the obesity is without obesity, they also, the diabetes is there, there is the chance of this metabolic problems is there, the chance of getting degenerative diseases like osteoarthritis, knee, hip, or other heel pain, and spinal problems, degenerative disc disease, all high, and it's double with study shows such diseases are double in diabetic patients, and also the knee replacement are all occurrences double in diabetic patients. Then when we come to reactive arthritis and autoimmune arthritis, the problem is the immune system. Immune system is doesn't know how to react to that's supposed to be a normal thing, it is abnormally reacting. Here the nutritional imbalance and the toxins inside the body is the major culprit. So when we treat also with immunosuppressants, such patients we start treating with immunosuppressant. Then even if many of the autoimmune disease patients may not be overweight, but when we are diabetic, but we when start with this immunosuppressants like steroids and other immunosuppressants, even the later generation medication, this biologicals, the chance of getting diabetes is very high. Even if there is one autoimmune disease, there are other autoimmune diseases like a thyroid problem. Even thyroid is again, it is a metabolic disorder, and it can promote diabetes, hypertension, dyslipidemia, heart disease. So if there is one disease is there, we can go into other diseases also. And especially the autoimmune disease, it can be a collagen vascular disease. It is not confined to, collagen is not confined to joint capsule or tendons or muscles. It is there in all our body, especially in the blood vessels. There is everywhere there is blood vessels. So wherever the blood vessels is there, that can also get affected. Even the eye, the sclera, the cornea, everywhere the collagen is there. So if it is an autoimmune disease, especially rheumatism and ankylosing spondylitis also, and these other systems also can get affected. So it is all the more, it is not only we have to protect the joints, the other organ also. In autoimmune diseases like the rheumatism, it is very important to know which is the triggering factor for the immune system to misbehave. So we have to correct that, and also we have to correct the diabetes. If it is there, diabetes is there, it has to be corrected. Actually, all the medicines, when you take the medicines, actually it is our body considering it as a toxin. So if you are taking medicine again for this immunosuppressant, and also these are anti-diabetic medicines, antihypertensives, all are for the body, it's a toxin. And especially the toxin load is, the load is coming to the liver. The liver may be, many of the autoimmune disease patients or these obesity patients having a fatty liver or a non-alcoholic hepatitis or an alcoholic hepatitis. So such patients, if the medicine also comes, the workload of the liver is additional workload is there. And also for the kidney, there is additional workload to remove all this, liver and kidney has to remove all this medicines also from the body. So whenever you take, you are adding the stress of the body to the medicines. If you are, even though you are taking the medicine for the joint, the medicine is reaching all the cells in our body. So they all see it as a toxin. So that is the reason for when you are adding medication with the lifestyle diseases, you are getting to more deeper, especially maybe many patients after starting medicines for a long time only start many of the diabetic problems or these joint problems also start. Next is the problem with the muscles and bones also. When you are having pain and we become less active, the osteoporosis, bone get weak, and also the muscles, which is sarcopenia, muscles get weak. And when your muscle is weak, the chance for a fall is very high. And also when the muscle is weak, muscle has an important role in protecting you're adjusting your body stability and all. And when your sarcopenia and musculosis is there and all the osteoporosis, the chance of fracture also will be high. And also when because of the pain, if you don't move, the joint get fixed. So inflammation and all this problem is actually drawing us deeper and deeper into trouble. Next, when we come into the treatment aspects, for the modern medicine, major medication is NSAIDs, that is to pain relief, and also some edema and inflammation also is reduced. And then is the corticosteroid. It can be taken as orally or as injection or directly into the joint also used to give to relief of pain, into the shoulder, into the knee. Everywhere we are using steroids. That is actually definitely they will give symptomatic relief. Initial stage there will be for 2 or 4 or 6 months you will get relief if you are getting a steroid injection to your joint, but it will recur, and it is steroids can actually accelerate this osteoporosis and other problems. The damage can be accelerated. And the next is the newer generation medicine like TNF inhibitors, actually tumor necrosis factor inhibitors. And they are actually, it is the problem with this sort of medicines, that is they are also acting cytokines, some sort of immunity related chemicals. Actually they are blocking the immunity related chemicals. The problem is the chance of getting infection and cancer is high when we are using it for a long time. If it's a short time, it's okay. But most of these diseases, if you are not finding out what is the problem with your lifestyle and correcting it, you have to take all these medicines lifelong. For if you are taking a TNF inhibitor for a long time, the chance of getting an lymphoma or other cancers is high. And also next is ILF, interleukin 17 to so many interleukin antagonists are there. That also is the newer generation immunomodulators or immunomanipulators actually. There is also the side effect is infection, and long-term side effect is infection and other autoimmune diseases and also the cancer. Then is the disease-modifying anti-rheumatoid drugs, that is DMARDs. There are also so many type of medications, and these are the things which is used. Everything has its own side effects because it is all are suppressing the immune system. So your defense mechanisms are suppressed, and also when in the immune system there is two wings are there. One is inflammation, other is the healing, that is anti-inflammation. Inflammation, anti-inflammation. Inflammation is the defense activities and the anti-inflammation is the healing activity. When you are taking an anti-inflammatory medication or immunosuppressant, both the inflammation and anti-inflammation or the healing activity also suppressed. So actually it is almost all the medications we are using in the modern medicine, especially as anti-inflammatory, this is actually it is acting on the omega-3 and 6, that is the two essential fatty acids. Actually this omega-3 and 6 is the controlling of the inflammation and anti-inflammation. That is almost all the medications we are using is suppressing this omega-6 pathway, that is actually the finer component, this thing is the arachidonic acid. It is actually suppressing the arachidonic pathway, and this anti-inflammation is the DHA and EPA, that is omega-3. That is why most of this rheumatism, this sort of things we take omega-3, this fish oil and all. So that is actually anti-inflammatory. The problem is the anti-inflammatory, if it's good, fish oil, omega, EPA, DHA, all is very good. But EPA and DHA cannot do work alone. They need the correct nutrients to body build the damaged cells, new cells. When the new cells come, that has to have the enough nutrient, the corrective proportion. In our body, it should be actually omega-3 and 6 should be in a 1:1 proportion. There is a change in the derailment in the proportion of this omega-3 and 6. That is from the food. It has to come, the essential nutrient, it has to come our food. And essential omega-3 and 6 has to come from our food, and if the proportion in the food is derailed, our immune system is derailed. Actually, that is the basic fundamental cause of all this inflammatory disease, and this is one is the change in the omega-3-6 ratio, that is ideally it should be around 1:1. The human body is made like that. And next is the other nutrition, the bodybuilding nutrient insufficiency or excess. Excess also, so glucose, the diabetes, glucose is excess. And in dyslipidemia, the triglyceride is excess. So excess also is damage. It will damage the system. So these things to be get corrected, then only we can get out of this disease. When you come to the surgical corrections or possibilities, there's definitely the knee replacement, hip replacement. Even now, previously we are actually disc was removed, or a part of the this prolapsium disc was removed. But nowadays there is a disc replacement option also is available. And for the ligament, actually for an injury, if it is happened, the ligament tear occurs, then you can do a endoscopic ligament tear correction and all. But if the ligament tear is happened because of the weakening of the ligament due to this autoimmune process, then even though you do the correction, there won't be much use at all. And it can even, you can increase the inflammation and introduce a infection into the joint and more create a problem. Actually, the ligament repair and all having major role only with the injuries. Even for an injury or because of that knee had a problem and replacement is okay, but knee replacement is not much of a solution for an autoimmune joint fixity also. And also when you are using this joint, the most commonly done is the joint replacement, is the knee replacement. So in here, that the upper part of the bone in both sides, it is cut with the electrical cutting machines and all. Then you are inserting a steel and plastic joint, artificial joint. Here, that is how then it is connected with the upper part of the lower bone and lower part of the upper bone with the screws, and also some cement. That is just like our construction cement. There is a medical cement is used for the fixing it, and there can also be the reactions can come because body they see this is a foreign thing, so there is reaction and it can create problem, and also the related with the anesthesia, operation and all, there can be problems also. That is the problem with the surgery, and there are medications, there is immunosuppressants, everything has its own complications also. Next, when we summarize it, the basic problem we should understand that these all joint problems, whether it is osteoarthritis, rheumatoid arthritis, gout, or reactive arthritis, ankylosing spondylitis, everything comes under the lifestyle disease. So there is a problem with the lifestyle, or can be because of it is may not be one food you are eating, like wheat you are eating. But some people it may be okay. But if a person who is having a gluten sensitivity, that they can get not only celiac disease, that is actually gluten sensitive. First we discovered with the celiac disease actually, but now many people who's having this arthritis sort of things, having allergic to or they are reactive to gluten. So we had to find out which is actually troubling. We can get disease only by either through food or through air or water or cosmetics we are applying on the skin. Only these four routes we can make us sick, or the radiations, that also that physical agents like X-ray or the sun ray, even the ultraviolet rays, if it is over, you can get burns and all, even the wrinkling of the skin comes because of that. So only through these agents, the food, water, air, and the atmospheric radiation, and the cosmetics or other things we are applying, the body can get toxins. That the toxins and also the nutrient. If you are able to balance this nutrition and reduce the toxin entering your body, you can the natural immune system will help you to get out of these problems. Actually, the immune system has the tremendous capacity to rebuild your body. So you are coming out of a disease only by removing the immune system is removing the damaged cell. Even if COVID virus is entering your nose or the lungs, the immune system has to remove that, and it is actually they are digesting with enzymes, and that is the funeral way is actually swallowing it and digesting it. The macrophages, some specialized cells, they catch the damaged cell. That is the damaged cell means if a virus entered in a cell, or it is even it is a senile, it is old age, got old. This macrophages, our immune system cells will swallow it and digest it. That is the way it is removed. And instead of that, a new cell has to come. And that is the healing happens in that way. New cell, if you can provide enough nutrient in the correct proportion. Actually, there is 57, as per the current our knowledge, there is 57 nutrients including water and oxygen is needed. 14 vitamins, 14 minerals, around 20 amino acids, and 4 fatty acids and dietary fiber. All these are needed for our body. And if you are able to give it in the correct proportion, we know what is how much vitamin D needed, how much B, C, or we know that how much is needed. So if you are able to give such a food and correct exercises to make your system stimulated, our cells stimulated, and even though you take the food, it has to reach the cell where it is needed. If the joint is needed repair, new cartilage, or the ligaments has to grow. But if you're keeping it still and not exercising it, the blood won't flow to there, the nutrient won't reach there. So we had to give mild stimulative pattern for the cells, then only you can reach the healing. And also you have to reduce the toxin. Nowadays we are taking so much of toxin in our food, colors, preservatives, tastemakers. We are giving only importance to the taste of the food, not to the quality or the nutrient content of the food. So that is the reason for this increase in the all these sort of diseases. And from when we think of the arthritis, most of it is because of the immune system derailment, and the repair of the body is not properly happening. That is why this repair is not happening, because of the nutritional lack, excess toxin, and also lack of activity or blood circulation, or the nutrient is not reaching. Even if you eat just like that, it is won't come to the joint. It has to be given the exercises. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present, and correct the lifestyle to reverse them. Also, it can be understood why medication and surgery cannot reverse such disease conditions. It is not the lack of medication or surgery that create the disease in the first place. This is why it is essential to understand how suitable lifestyle changes can only reverse these diseases and, more importantly, prevent their recurrence. Before any invasive interventions or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders, who are usually those who need to support the patient and share the consequences as well. Very often there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook guides many to be opportunistic and take advantage of the surgical options available primarily on the financial availability angle rather than on an overall picture. This is where the statistics that often provide us the huge percentage of unnecessary surgeries done on unknowing patients deserves maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of undesired consequences or even death from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is constrained by chronic lifestyle diseases, and if the advantage of reversing them with the lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for a majority of surgical interventions. We need to be proactive in health and not wait for the disease conditions to reach a stage where we lose hope of the ability to actively reverse our health problems with self-motivated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer, and this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions, and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrient formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal, and immune activities. Optimized nutrition, along with the Oxyflex, is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc., thereby reducing the need for medication and surgical intervention. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fatty tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like heart, liver, kidney, pancreas, etc. Status of the system like circulatory, immunity, endocrine, metabolic, etc. and the compatibility status of food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulations restores and retain optimized circulation, metabolic activities, hormone balance, immunity, and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition and help the repair and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome the vast majority of lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune diseases, cancer, etc. This also helps to avoid the need for medication and surgeries. Next is, what is the benefit for this arthritis patients with this clinically supported lifestyle correction? Basically, in clinically supported lifestyle correction, we are ensuring all this 57 nutrient in the correct proportion, and activity, because all these patients will be having pain and joint problems and all. So it's a segmental sort of activity which can be done on a lying down position or on the sitting position. That is the base of this oxyflex. That is actually the pattern of exercise. So it is aimed to activate all the muscles and bones in the body. That is around 650 muscles are there, 230 bones are there, and around 350 joints are there. All these are stimulated actually in a phased manner. Even it is possible, this pattern can be followed even for an arthritis patient. And initially there may be some having stiff joints and all, may not be possible, but gradually with this they will regain the flexibility. That is what we see. And next is how minimize the toxins, or if they have a toxin inside the body, the most important toxin in our body is the fat itself, the obesity. And even the people who are lean also, with the diabetic, this arthritis patient will be having more fat in their body. And actually for the gents it is only less than 10 to 15%, and the ladies around 15 to 25% fat can be there. But even excess is there, means the proportion is changed. And also this inflammatory fat, that is omega-6 fat, if you are eating more of this nuts, badam, pista, peanut and all, have a very high amount of omega-6 fat is there, fatty acid is there. So those patients will be having an inflammatory body. Those excess fat has to be removed. That is also an important thing. So if the fat level in the body is excess, we will have a low calorie diet also. But with the low calorie diet, we are ensuring that all the nutrients are reaching the body and without any color, preservatives or tastemakers. So if more toxins comes, then the immune system has to work more. Actually, we are trying to give the immune system a rest. Let them take care, because they are overstressed. They don't know what to do. So much of inflammation, so much problem. So the inflammation part is suppressed, and the anti-inflammatory, then the healing part is stimulated by giving nutrition, oxygen, water, all the vitamins, minerals, etc. When a practical experience with the patient, this is a lady 55 years and her weight is 63.5 centimeters. And she is suffering from rheumatoid arthritis for the last 13 years. Obesity is there, definitely. She's at this age, she should be less than 50 kg or preferably 45 kg. And her body fat percentage was very high, around 43% is fat. She should have less than 25 only, but her fat percentage is 43. That itself is the reason for her disease itself. And BMI is 34. And she is many inflammatory markers such as CRP and all is high in, when we look into her. And with she has taken many medications, and in here we have other systems of not only modern medicine, other systems like Ayurveda, Homeo, Unani, everything she has tried for the last 13 years, and she's suffering from umbilical hernia also. She was asked to do a surgery and fibromyalgia, and she's getting giddiness and vertigo she's getting often. That was the situation when he came, and her knee pain is there. She was advised to have a whole joint, all the system, hand, shoulder, knee, and the spine also. She's having major spine problem also, and she was advised to have if it is continuing, she is advised to have a joint replacement also. And after, when we start her treatment, actually because none of the systems are giving her results, so she has stopped all the medications before she came here. And with this clinically supported lifestyle correction, actually she was joint pain in the 8th day. Actually, we start after the first day, start the thing, and in between we are following it over the telemedicine. And on the 8th day when she came again, and her joint pain has decreased. And on the 15th day, he was almost symptom-free actually. So it is a bit difficult for you or anyone to believe also, because it is the reality actually. After 15 days, there is no symptoms for the patient. And when we started, her weight was 83.5, and by 90 days, he came down to 70 kg. and even her body age, when she was only, her real age is only 55. When we started, her age was 75, and when at the end of the 90 days, it is 69 kg, and her body, say her weight is 70 kg, and she has reduced almost 14 kg weight, and her 11 years she has come back, and actually she should come down again. She has to reduce weight further actually, and we are expecting to the 6 to 9 months. I want her to come down to around 55 kg actually. Her height is only 155, so ideally she should be below 50, but because she has tolerated this much, 83 kg was tolerated, so she, by coming down to 70 itself, she is very happy. But if she is able to come down 60, then her health will be much in a better position actually. Next is a patient who is a male. He is suffering from psoriasis for the last 15 years, and arthritis, psoriatic arthritis actually, for the last 4 or 5 years. And he has already found his fingers and all deformed. He is not able to even our usual namaste. He is able to do it with difficulties. His fingers will not close together actually. He is having psoriasis, skin lesions all over the body, especially the legs and hands, even the exposed areas it was there. Even the face was exempted, but the scalp and the hair loss and all was there. And when we come to his also, he was also actually, he was fed up with all the medicines, all Ayurveda, Homeo, modern medicine, everything he has tried and fed up. And before he came, he stopped all the medicines actually. And his major symptoms were pain, tiredness, itching and scaling, discolorations, movement restrictions and all was there. Actually, he says that almost 50% is over in the first week itself, and itching by 15th day, itching and the skin becomes almost getting corrected. It is not fully corrected. By 30th day, when he comes, his skin lesions are almost cleared, no scaling. Only that color has to come. Then some areas were darker and some areas were more white also. That was the only thing for the skin. The psoriatic part is over by the 30 days, but the joint stiffness and all, stiffness and the major problems, pain and is over. But he is not able to, he's very busy person and is traveling a lot, and he is not able to follow the things in the proper way. And also when we looked into his intolerances, food intolerance, he's intolerant to many milk and milk products, and even some vegetables like we commonly use tomatoes, lady's finger, mushrooms, and this pea, and so many things were, it's all individualized actually. So I'm not elaborating what all things his system is reacting. All such things were removed, but he's taking in between some things and all. If she takes some intolerant thing, then there is symptoms can recur actually. So we have given him light immunosuppressants and painkillers, anti-inflammatory agents also given. If he gets, and also if too much of cold comes, again he can get it. The climate change can also affect this sort of autoimmune diseases. So that also, if they come across such a situation, mild medication, not daily taking any anti-inflammatory and or immunosuppressants. If a stimulant comes for 1 or 2 days, he can take and then go ahead. The only thing he has to continue this, avoid this, ensure that all the nutrition are there in his food, and especially till he is getting completely cleared of all the joint problems. And after also, he should avoid this food and things which is intolerant, and also the food additives and all. It will also, the immune system, you have to give its immune system rest, give proper nutrition and less toxin, and give stimulation, that is exercise also. This is what is expected. The last two patients we have discussed is mainly of the autoimmune nature. This is a patient with metabolic disorders like diabetes. She is suffering from diabetes for the last 18 years and on insulin and many diabetic medicines, and she is having varicose vein. That is also, the latest study shows that varicose vein also is an autoimmune disease, and dyslipidemia is there, hypertension. She is taking, this is all comes in the metabolic syndrome, diabetes, hypertension, dyslipidemia, all is there. She's taking that medicines is there. Her height is 160 centimeters and 82 is the weight. And even with the medication, she's BP is high, 160/90, and HbA1c is 7.4. And before we start, we analyze all the parameters, and also her, because she's diabetic, we checked with the GFR also. Her GFR has come down to 57, and creatinine is high, and multiple problems are there. But she's not clinically supported lifestyle correction for us. All this can be cured. Actually, not cured, we can be reversed with this. Actually, for the diabetic patient, if it is a type 2 diabetes and her insulin level is very high, actually she's having an insulin resistance type 2 diabetes, and we stop all the diabetic medicines in the first day itself, because you cannot take a low calorie diet with diabetic medicines. So she needs a weight reduction, because her weight is 82 kg, and she has to reduce at least 20 kg weight reduction is needed. So when a patient is needing weight reduction and low calorie diet, they cannot take a diabetic medicines. When we start clinically supported lifestyle correction, within few days itself BP will come down. So for this patient, when we started her lifestyle correction, it was she was taking insulin, and 7 medications was there. It was reduced to, by 30 days, by 30 days, all the medications can be over. Only the mild medications, if she is having a pain or something, for SOS, that is, if needed, she can given a painkiller and the thing, not for regular use. If she is not able to do the exercise, she can take the medicine and do the exercise. That's all. And see the changes also within 30 days. 7.4 to her HbA1c came down to 6 within 30 days. Actually 30th day, just HbA1c is 6, and all the diabetes, BP was come to normal. It's only 130/80 on the 30th day. That is without medicine. That is 7.4 HbA1c with the medicine, and without medicine it is 6. And GFR, the kidney function also has improved, and it was by 60th day it came to 74. So it can reverse not only the diabetes, not only the hypertension, cholesterol. Without medicine and statins, it has come down, and also she is able to walk freely. Her major problem was not, as far as patient is not concerned about the diabetes, hypertension, or kidney CKD, or nothing she is concerned. She was concerned only of the joint problem. She want to walk, at least without pain. At least she has to do her own basic activity. But by 90 days, actually, she came down to weight 69 also. So she's able to reduce her 13 kg also. So, and when she came here, her body age was, actually she's only 66, body age was 80, and it came down to 64 actually. So aging also, reversing the aging also, that is important. Actually she's not getting out of this joint problem or arthritis, but all the lifestyle diseases can be reversed by this clinically supported lifestyle, because we are doing is to correcting the body composition and correcting the immune system and correcting the hormone system. That's why that is what is needed. Actually, it is not because of any deficiency of the medicine or surgery. She's getting this joint problem. She was actually advised for a joint replacement surgery for the knee, and by this actually she's escaping a joint replacement surgery and also getting out of all the medications for this, all the metabolic syndrome, diabetes, hypertension, etc. This is another patient who's a rheumatoid arthritis. He's 46 years and his height is 170, weight is 66 kg, and he is suffering from rheumatoid arthritis for the last 8 years. And he has his anti-CCP, rheumatoid factor, and all is very high, and also he's having maybe an autoimmune hepatitis also. His SGPT and SGOT is very high. 940 is the SGPT, and ALP SGOT is 577, and this all inflammatory markers, CSR, HSCRP, CRP, blood count, etc. are also is high. And TPO, another immune factor, is also, even though his thyroid function is normal, thyroid antibodies are also there. And he was taken many sort of treatments are like Ayurveda and Homeo and this thing also. And also he is taking, when he starting treatment, he was taking cholesterol, dyslipidemia, cholesterol, rosuvastatin was taking, methotrexate was there, hydroxyquinone was there, and along with that folic acid is taken, and also diclofenac, that is NSAID medicine is there, and also he is taking steroid medication also. Actually, he was able to come out of all these medicines within 30 days actually. The methotrexate, actually, he wanted to stop the methotrexate. He himself reduced methotrexate dose. He was taking 20 milligram because this liver function is also getting affected. So methotrexate is can damage the liver also. By 30 days, actually he is able to, the 8th day itself, the 8th day when he came itself, his pain and all is subsided. His making is comfortable. By 30th day, he is saying that it is almost 80% of his problems are over. And the medication also is almost 80% of the medication is over. And by 60th days, all the medicines are over. And he is able to function normally. And he was not overweight or anything, but even though he is able to reduce the fat level. Actually, he was 67 kg was there, but his fat percentage was very high. So he was advised to reduce the fat also. And he came down, his fat level came down to 17%. It was actually 22%. It came down to 17%, and his body weight also is reduced to 62. And actually, he was not, accelerated aging was not there. But by the end of 30 days itself, he came down to, his body age came down from 41 to 36. The liver enzymes also, actually it was very high initially, and it came down to 74 in the 30th day, and SGOT by 50, and by the 60 days it has all come down to normal. Actually, with the clinically supported lifestyle correction, we are actually correcting the body, not the body composition getting corrected. When the immune system gets corrected, this autoimmune activity reduces. So for this, we have to find out which is actually triggering the problem actually. So the immune system is controlled by the omega-3 and omega-6 fat, and actually the fat is controlling your immune system in effect, especially the omega-6 and omega-3. So when it is getting balanced and you are avoiding all the toxins, including the intolerant food, and the toxins inside food like color and preservatives and all are reduced, then naturally the immune system get corrected. And also when the excess fat is gone, your insulin resistance is going, and your blood sugar level will come down to normal. And also when the hormone system is corrected, your hypertension, if you are hypertensive, you get down to normal. And the excess fat in the body is removed, automatically the blood level fat, the lipids in the, that is dyslipidemia also get corrected. So usually in this clinically supported lifestyle correction, within 2 weeks itself, the major symptomatic relief will be there in the first and second week itself. And usually that almost all the medicines can be tapered off within a month itself. But if a patient who is taking this steroid medicines or immunosuppressants, it may take 2 or 3 months also. If the sort of patients will be on heavy dose of immunosuppressants like methotrexate and MMF and so many, 3-4 immunosuppressants are there, gradually only we can reduce. This was only a few medicines, so it was over by the second month itself. Focus of clinically supervised lifestyle modulation is not on the symptoms. Focus is on the lifestyle parameters to be corrected to set right, the undesired variations in the body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patient can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from diseases is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition, or when suffering from multiple disorders, or taking chronic medication, or suffering from the ill effects of chronic medications, or when the surgery is under consideration, the need for clinically supported and supervised lifestyle modulation become necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with the emphasis on the benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods, and treatments along with the benefits and side effects. Practical aspect of the lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.